Certainly, what we're seeing over the last, recent history is that many of the, advanced nations in the world, they're really undertaking large-scale projects to try and develop e-health for their own populations. So you have some very large projects, very expensive projects being undertaken by many countries, and you've heard the challenges that we have in Hong Kong. Everybody has their own different challenges. It is in any country. This is a challenging project, but we see a lot of activity, a lot of funding available. So I think it is going to be the future, but there may be a lot of detours and roadblocks on the way. But we see the resolve of most nations to try and get there. We've created a generation of shall we say, health IT literate doctors. In particular, many of those doctors have been involved intimately in the whole design, development, implementation, and subsequent evolution of our systems. And so the system in the hospital authority, which is called the clinical management system, or the CMS. The CMS is very much a system which has been developed by doctors for their own use. And so having people with that sort of engagement in these systems, that's been a key to the success, that they feel really engaged. So what we're really doing with the eHR program is taking that sort of concept of engagement, deep engagement, and trying to now engage the private sector. So that's going to be, we think, another very important point, is how do we engage private practitioners to the same degree that we've managed to engage clinicians within the HA has also been involved in education programs. For instance, we're currently teaching a certificate program at Hong Kong U Space, and certainly the level of interest in that program has risen significantly over the couple of years that we've been involved. So we think that it is important to really raise awareness and in some cases to quite a significant degree with these sorts of training programs. One of the strategies for the electronic health record program is actually for the HA to make available its expertise, and in some cases its actual technology, to the private sector. So we will actually be developing versions of our own clinical management system for use by private hospitals. So making a version which is more suited for their use. Also, we'll be developing a system for clinics to use, and we call that the CMS on-ramp. So a very easy to manage system for smaller scale practices, which will allow them to join the eHR sharing relatively painlessly. So the HA is going to be developing those, and we'll be developing those in partnership with the private sector clinicians. But I think it's important that we also see that there is going to be a need for the local IT industry to come forward and support these systems and install these systems and so forth for the private sector. So we think that's something that the private sector can step up and sort of provide those sorts of services as well. So the HA really is continuing to develop its health IT systems, the CMS and the electronic patient record within the hospital authority. We're really pushing forward with our next generation. We call that the CMS Phase 3. And so some of the major initiatives in that, first of all, we're redoing the whole system on a sort of modern technology base, sort of make it robust for the next, hopefully, decade or so. But apart from that, we're building lots of new features which will really support the workflow of clinicians, support their decision making. But I'd like to highlight two aspects of the CMS which I think may be of interest. So first of all is we're developing a system where for all medications which are being given within a hospital stay, currently all of our medications which are given in the outpatients or upon discharge are already done electronically. But for the inpatient stay, it's actually a much more complicated environment. We're still on the old sort of paper system. So we're going to be building that system, starting from this year, is to make that whole process electronic and, with lots of barcoding of patients and drugs to make sure that everybody gets the right drug at the right time. That sort of technology hopefully will make, healthcare even safer. The other one I want to talk about is the filmless project. I don't know if you know already, there's a lot of radiology, X-rays, CT scans, and so forth being taken every day, and now already we're sharing those electronically within the eHR. We're already doing that, but we haven't really had enough. We haven't had the infrastructure in place to totally get rid of the actual physical films. Physical films are a problem. They get lost. They're heavy. They deteriorate over time. They have the chemicals in them and so forth. They're expensive. So we're really hoping to move away from the film and move totally to a digital film, and that's a big project that we're undertaking again as we speak. So those are a few of the things that we're continuing to push forward in the hospital authority, and hopefully, again, over time, these things may flow out and into the wider Hong Kong healthcare arena. We've developed the systems in the hospital authority. As I said, it's been an in-house effort, but it hasn't been done in a vacuum. We've certainly kept in touch with developments in the field overseas, and one of the really important areas of global development is in standards. So I'm talking about the way that medical information is coded, medical concepts are represented, and that sort of thing. As you know, medical language is a very complex thing, and there are standards which help to sort of try and standardize that. So the HA has been using a lot of these standards internally, or adopting them for local use, so localizing these. And so again, HA is going to make all of this work available to Hong Kong as part of the eHR program. And eHR, the whole eHR, is going to be built upon standards which are building upon the work that HA has done over all these years. Our first phase will be completed in 2013-14. Yep, and there is plans for a second phase after that, but I think we'll come to that when we get there. But so the first phase will involve the records sharing infrastructure being in place, and people being able to already share their records amongst those doctors who have joined the scheme.